There was never really anything else I was ever going to do. I was always going to be a surgeon, and I was always going to go to med school. I didn't decide on neurosurgery until I was actually in medical school and had gotten into neuroanatomy, and then that sort of changed my mind and put me on this track. And I became interested in spine surgery during my training. For the most part, I deal with a lot of degenerative disease of the spine. We do deal with some adult deformity and scoliosis, also with tumors of the spine. But for the most part, what we deal with is arthritic conditions and degenerative diseases of the spine. Some surgeries are a lot more significant, so the recovery time is, can be up to 6 months or a year getting over it. So it's a much slower realization for that. But patients who come in and it's really the patients who are very, very disabled, have very poor quality of life. They typically, quite honestly, they do the best. They see the most dramatic results. I do quite a few virtual visits, trying to increase it, just because we have a number of patients that travel a long distance, and even if they're just coming across town, it's still much more convenient. So, and it's easy. So I think it's a great solution. It's getting to the point where really pretty much anybody's going to be a good candidate for it. I think the only limitation is a lack of physical exam. So for the most part, new patients, they need to come in and we need to do a visit. We need to examine them and touch them. But after that, follow-up visits, post-op visits. My wife and I, we like to basically, as much as possible, get outside, walk the dogs, get out, exercise. We like to travel as much as possible.